What causes bedwetting? Natural remedies TV presence. Most of the time, despite medical intervention, parents discover no known cause outside of genetics for their child's bedwetting. Having said that, here are some of the reasons that have been found to lead to bedwetting. Small bladder. Some people are born with small bladders that cannot hold as much urine as others. This often shows up in older kids pre-puberty. If your child is dry at night and starts having issues after age 8 or 9, a doctor can determine if this is the issue. UTI, a urinary tract infection, can lead to bedwetting in kids because they tend to hold their urine to avoid pain until they're deep in sleep. Emotional disturbances. While stress, fear, and anxiety don't actually cause bedwetting, they can lead to having an issue with bedwetting due to the change in habits. Eating more, not sleeping well, and so forth can lead to issues that cause bedwetting. Health issues. Diabetes can cause overproduction of urine, which can lead to bedwetting. If your child was fully dry at night and then 6 months later or more starts bedwetting again, it can be a sign of diabetes. Sleep apnea. While this problem happens more in adults, it does happen in kids, especially if they have abnormally large adenoids. If your child snores while sleeping and wets the bed, take them to be checked out by a sleep specialist or an ear, nose, and throat expert. Hormonal imbalance. Some people, it turns out, don't produce enough of the ADH hormone that controls urine output. If this is the issue, a doctor can prescribe medication to help. Overactive bladder muscles. If your child has an overactive bladder, they may be triggered to urinate before the bladder is full. They may have issues during the day with frequent toilet use but low output. Medication. Some medication, especially if it leads to deep sleep, can increase the risk of nighttime bedwetting. Constipation. This is often a very significant cause of children wetting the bed. If your child's colon is full of waste, it will put pressure on their bladder and make them pee while they are sleeping. You can cure this problem by curing the constipation. Genetics. Science has shown that most of the bedwetting in older children is an inherited issue. In fact, more than 3/4 of bedwetters are related to a bedwetter. Genes that help you control your bladder may be in play if your child is wetting the bed. If your child is wetting the bed at least 2 to 3 times a week at age 7, make an appointment with your child's pediatrician to ensure that there are no medical issues that can be causing it. The main issue really is serious health concerns like diabetes or other neurological problems. Other than that, most bedwetting is not bad for you. It's merely an inconvenience that you can deal with by using bedwetting tools like alarms, mattress pads, and waterproof underwear. Home treatments for bedwetting. Bedwetting can be very frustrating for parents and children. It's messy. It can smell. And let's face it, it interrupts a perfectly good night's sleep. Thankfully, there are ways to deal with bedwetting with these home treatments. Remember that there is usually no cure for bedwetting. Treatment normally involves just a matter of biding your time without making it worse. Withhold water near bedtime. About 20 to 30 minutes prior to bed, don't give too many fluids. If you start getting ready for bed with a drink of water, a bath, getting dressed, and an excellent nighttime story, you can allow that time to deal with going potty right before and if still awake right after the story time. Take your child to the potty right before bed. Always take your child to the potty before bed. They brush their teeth anyway, so they may as well use the potty. If you do a long nighttime story and your child doesn't go to sleep, offer for them to use the potty before sleepy time. Plus, studies show that nighttime rituals assist with sleep anyway. Get night lights. Some children, it turns out, do wake up to use the potty at night. However, they are afraid to get up and go potty. They may be fearful due to the darkness. Try to light the way to the potty with night lights. You can use LED rope lights to make it extra festive. Give them permission. Another issue that sometimes happens is a well-behaved child might be afraid to get up out of bed at night due to parents telling them not to. Make sure that you've told your child that getting up in the night to use the bathroom is totally acceptable. Read potty books. A great way to spend your story time is to throw in some of the bedwetting and potty books for children that fit your child's age group. This is going to help them realize they're not alone and possibly give them the confidence to overcome it. Show your child how to change. Giving your child the responsibility for their bedwetting is a great way to not only teach them self-care but also to give yourself a break. One reason bedwetting is frustrating is the mess. But if you set up a system that enables them to change their own clothing and their own bedding if needed, life gets a lot easier. Use waterproof mattress pads. Pads that go right on top of the sheets and mattress, and that can be easily washed, will make your life a lot easier. If you don't have to change the entire bed every single night, it'll make everything simpler. Buy waterproof underwear. This is a great invention that can work for some kids. It does depend on the volume of urine they're losing each night while they're asleep. But these combined with a mattress pad can help you avoid too much work. Practice stoicism. It's difficult sometimes to not be emotional about a child's issues with bedwetting. However, and this is especially true if a child is bedwetting due to a behavioral or emotional issue, like divorce, if you can act like it's inconsequential as you take care of it, that will help avoid more behavioral problems. Reward effort. While this flies in the face of stoicism, which will help you deal with this issue best, some children who are wetting due to behavior issues and not just due to being hard sleepers can benefit from positive reinforcement. Get your child a physical. Just in case there is a physical problem, if your child is 7 and wets the bed a lot, more than 3 or 4 times a week, get a physical. The doctor can rule out any physical issues causing the problem. The main thing to do about your child's bedwetting is to deal with it in a way that doesn't make them feel bad about themselves. This is especially important because most of the time, bedwetting has nothing to do with behavior but is simply due to lack of readiness and physical development. What to say to your child when bedwetting happens? One of the most significant issues dealing with bedwetting is trying to mitigate the emotional damage your child is experiencing. Thankfully, there are ways to deal with bedwetting to make your child feel more confident despite the issue. The trick is to talk to them openly and to give them some control over themselves, as age dictates. Under 3. If your child wets the bed and they're not yet 3 years old, they probably just aren't ready physiologically yet. The best way to deal with a child who is not yet 3 is to talk to them about using the potty, read books to them about the potty, and point out how people and animals use the potty. Don't try to force them to use the potty at this point, though, as you don't want to start a power war with your toddler. During diaper changes or bathroom visits, be as unemotional and stoic as possible. Don't make faces about the smell or make it a big deal. Just do the business that needs to be done without comment or emotion other than positive praise when appropriate. 3 to 5. Once a child hits 3, most are ready for more serious potty training. The best way to deal with accidents at this age is to give them as much control over it as possible. If they can change their own clothing, put their wet sheets in the laundry room, or put the pad in the hamper, it's going to make it less disruptive to everyone. Again, when an accident happens, rather than focusing on the accident, focus on cleaning up the mess as easily as possible without emotion. Treat it like it's a matter of fact and get them to do most of it themselves. 5 to 7. If your child is wetting the bed at this age and you react emotionally and angrily, you're just going to make it worse. You can be sure that they're not doing it on purpose. Take them to the doctor to ensure they're healthy, but this is the time it's even more important to behave without emotion regarding accidents. Give them full control over cleaning up their mess from the accident, but let them know it's okay to ask you for help too. The more you can empower your child, the less this time is going to emotionally scar them. 8 to 11. If your child is wetting the bed between the ages of 8 to 11 or is experiencing a regression, take them to the doctor to rule out any medical issues. Examine the stress and anxiety or any changes in behavior and habits that can lead to problems. When you talk to your child about their bedwetting, do it in a non-judgmental way. Talk to them about the facts regarding bedwetting and how for most kids their age it's a genetic issue that they will usually outgrow around the time puberty happens. Older. If your child is older than 11 and still wetting the bed, it's likely they are experiencing a lot of anxiety regarding the secret they feel they need to keep from their peers. This is a time that you might want to involve a counselor to help them learn to deal with it. Know that they're not doing it on purpose. Be open, empathetic, and kind. Teach your child at all ages to clean up their own messes without judgment. They're not doing it on purpose and just need more time to fully grow and mature physically. If you act as your child's safe place, the emotional damage will be limited. This is the most you can hope for in this case, as for most people bedwetting goes away before adulthood and is not their fault.